So the first thing is healthcare is about people. Everybody is a stakeholder in health. Everybody has health issues. Everybody has the potential to fall ill or to have a loved one or a neighbor or a colleague fall ill. And so one of the first things that I said to myself on taking that state health leadership position as commissioner was to recognize the fact that my stakeholders in the ministry are not just health sector professionals or health sector leaders, but the general populace, because everybody should have a say in health.
What a pleasure to be in PHCT, in your city, to interview you for our edition of the Curated Conversation.
Thank you.
Our guest today is an accomplished family health physician. She's a public health strategist. She's an academic, recently conferred a professorship, and has dedicated her life to driving health equity, innovation, and sustainable development across Nigeria's health systems. Also, she is the immediate past Commissioner of Health for Rivers State. Please welcome our guest, Professor Dr. Adaeze Oreh.
Thank you very much for having me on Curated Conversations.
So, Prof, you've built an extraordinary career across clinical medicine, academia, the blood services, and public sector leadership. Looking back on that journey, were there any defining moments or experiences that shifted your thinking from individual patient care, as you have experience in, to a systems thinking and the need for health system strengthening?
From that question, I think the most vivid recollection I have is incidentally in the patient ward. And it was in this male surgical patient ward in the University of Nigeria Teaching Hospital in Enugu, where I trained as a medical student. So before that, my ambition in medicine was to be a cardiologist. And I think that ambition was there from perhaps maybe my second year in medical school. I was fascinated by the physiology and the workings of the heart and the cardiovascular system, the blood vessels. And that was where I saw myself, specialize in narrowing down in my future career in medicine. But I think that day, it was an afternoon, I was in the ward interacting with patients. And I think various other smaller experiences with patients as a medical student in training culminated in that moment when I felt that there was so much more that needed to be done, because I could see vast differences in how patients had access to treatment. So there in UNTH, you would have patients that came from villages, from communities, that came from the city or other cities. And I could see the vast difference in the opportunities that they had to have preliminary care before even coming to the specialist teaching hospital. And so that moment gave me some sort of clarity that what I wanted to pursue was a career in working to strengthen the health systems and close the divisions and the divides that entrench the differences in how people access healthcare. So whether they're from the rural communities or rural villages, or whether they're from the cities, whether they're educated or uneducated, I saw then that a lot of what our system was lacking was a system strengthening approach. And I think if you ask me for one defining moment, I think that would be it, as a perhaps fourth year medical student then. Yeah.
And that has inspired your work, really, because that also leads next to my into my next question, because your work as commissioner, you led various health reforms and earned numerous awards, including one from World Bank and the Malaria Impact Project. And, from your experience, what can you tell us about translating policies and health reforms into measurable health outcomes?
So the first thing is healthcare is about people. Everybody is a stakeholder in health. Everybody has health issues. Everybody has the potential to fall ill or to have a loved one or a neighbor or a colleague fall ill. And so one of the first things that I said to myself on taking that state health leadership position as commissioner was to recognize the fact that my stakeholders in the ministry are not just health sector professionals or health sector leaders, but the general populace, because everybody should have a say in health. And so with that in mind, knowing how to communicate cross-sectorally. So the thing with health policies is those of us who are in the health space, we have very fixated ideas from our training, from our experience about how things can work. But a lot of times we forget that there is a major element in that equation, which is the people and the communities where those health policies would work. And then there's also the authorizers. So we have the ideas about what can work for health, but oftentimes you need somebody to sign off for that policy to be implemented and funded and executed. So we're used to talking to ourselves, but we need to broaden and strengthen how we talk to non-health sector people who are in a position to either fund or authorize those health policies, so they have an understanding beyond our health terms, an understanding that communicates the value of those policies to them if they are financiers, they're economists, they're education leaders, or they're people in energy, which has implications for healthcare as well. So you have learning to communicate the value of those health policies to them. And at the same time, never losing sight of communication with the communities that we seek to serve. Because we all know about trust issues, and where there's no communication, then there cannot be any trust. So the communities too understand what those health policies are and are in a position to share what their own lived experience from their community, so that they weigh in on the co-creation of health policies. That, to me, are some of the necessary ingredients for successful transformational health policies.
I think that's very key that you've emphasized so much on communications, because you've been very strong on visibility back from your work during COVID. How has communication, strategic communications and partnerships and the visibility that you continue to give shaped your work and how people engage with health systems?
So the first thing is strategic communications is important, because that's how you're sharing the work that you're doing and the implication to the communities, to the people who are meant to benefit from that healthcare work. But aside from that, partnerships are important, because what it does is that it expands your platforms to share. We all have our own areas of expertise, and if we dig down and insist that we're going to stay within those areas, then we limit ourselves, we limit our reach. So that's where the partnerships come in. So partners offer you a broader platform to share the health education, health promotion, advice or insights as a public health leader that you may have. And so that was one thing that I found very beneficial. Even during COVID, I found myself speaking on platforms that I wouldn't normally speak to, because I had a broad network that I was engaging with, and they opened up doors to wider platforms. And so, interestingly, some of the feedback that you get also helps in your own public health knowledge building. And that's why I tend to encourage colleagues as well that shying away from strategic communications is not helping public health work, because public health is about communicating and sharing with the communities.
Thank you. I think you've done and you continue to do such a good job at sharing your knowledge on LinkedIn. We see your work and you're very active. It's so many recognitions actually coming in. They continue to roll in. Could you tell us a bit about what you've seen? I mean, it's very obvious the workforce challenges that Nigeria faces, from leadership gaps to workforce migration, the Japa syndrome. From your experience, what can you tell us about what the government and the country should do to both nurture and retain good talents that we know that we have?
Yeah, it's interesting that you're asking me this question, because that was around the theme of the discussion at the ongoing Nigerian Medical Associations conference that we are at hosting right now in Port Harcourt. And there was something that I shared in the keynote. Retention is actually the least expensive form of recruitment. So you have an existing health workforce, but we tend to look at the whole brain drain and Japa syndrome from the lens of a purely health sector problem, but it is not a health sector problem. It is a system-wide problem. Of course, the implications for the health sector are in your face. They are massive. They have life-changing implications. So a lot of times that is what gets the attention. But colleagues and I over the years have actually conducted research on health sector professionals. Why do people leave? And when you look at it, a lot of the reasons why people leave: security. You cannot take the insecurity issue out of the Japa syndrome conversation. And that is not a purely health sector problem. It's a societal issue. A lot of the people who end up leaving the country may not have started out thinking they were going to leave. They feel pushed and propelled to leaving because for a lot of people, there's a sense of hopelessness. There's a sense of helplessness in terms of either, apart from the security thing we've already mentioned, economics, where the finances are not financing. Yeah. And you're looking at colleagues across the shores and they seem to be in an economically stable environment where they get more value for the work that they do and they live more peaceful lives.
Without the risk of being beaten.
Without the risk of being beaten or kidnapped or whatever. And then on the other side, you have a health sector that is underfunded. And so with that underfunding, the potentials for professional growth, working in an environment that is intellectually and medically stimulating for professionals is not, quite there. Many institutions are challenging. And that's not to belittle some of the advancements that have happened in the past several years, but there's still so much work to be done. And another angle to it is because healthcare investment, and this is something Nigeria Health Watch has consistently emphasized in various conferences and dialogues, is that we should stop looking at healthcare investments as throwing money at social goods. We should look at it as a sound business economic investment. Funds that go into the health sector, aside from the fact that it's keeping the lights on, the patient wards are functional, there's running water in the hospitals and the facilities, that's a supply chain of medicines, commodities, staffing, communities that will, generate economy, because you have functional hospitals, people come into hospital with relatives. That's a life force that we don't actually look at in terms of the benefits of investing in health. Your training, the pipelines, the medical education, there's an ongoing national policy driven by the federal government to enhance trainings in health training institutes. the numbers of people that are graduating, but they will graduate. They need health facilities that are functional to absorb them as they graduate.
Unless they travel.
So those are some of the conversations that oftentimes we don't quite discuss as broadly when we're discussing the whole Japa syndrome. It's looking at it as a business case. How many partnerships between the public sector and the private sector can government enable that will scale up the number of people who can be employed within the system? And then what is the attention for healthcare innovation so that solutions builders can be thinking about how to improve on the services? Innovations around turning around waiting times, let people not wait in the waiting rooms for so long. But are our facilities resourced enough to start thinking like that? No. So when a lot of the facilities are just working on survival, then innovation takes a back seat. But this is the broader conversation that we need to have around retaining people who have decided they're not leaving for now, and attracting people who are coming out from our training institutions, and even people who are in the diaspora who want to still give service. There are so many of them. My role as commissioner opened my eyes to just how big that was. The number of professionals in the diaspora that are interested in consistently giving back and contributing to the health sector in Nigeria.
Wow, that's a very insightful take. Really been enjoying the conversation, and now really want to hear from your experience, having served in so many various capacities as a physician, as an academician, a policymaker, a global health advocate. What has this journey taught you personally, and what kind of future would you like to see the next generation of future health leaders build?
I would say that thinking of the next generation of health leaders, I would want to start with a note of them not being despondent or discouraged by what we see as the status quo now, but for them to take it on as a challenge and build courage, because there will be a need for courage to disrupt. There will be a need for courage to innovate. And sometimes innovation is not necessarily coming up with a new solution, but maybe coming up with a new way of handling an existing solution, a new approach. And so I would want to see the next generation of health leaders being courageous, being resilient, being able to take on setbacks and challenges and just dust off and keep pushing, and be more collaborative. The future of health is not in the health space alone. It must be intersectoral, it must be multidisciplinary, and we need health leaders who are able to engage and interact across sectors. And it must have a community orientation. We need to have a decentralization of quality healthcare delivery strongly across our country and across the continent. We have already a wealth of people. We have a massive population that is set to even double or triple within the next decade. And so building on that strength will be a community approach to how healthcare leadership takes place.
Wow, thank you so much. And I'm glad that we could end on such a positive note, forward-looking note, not just for our future health leaders, but also for those of us still very active now. And yes, because within the various challenges that you had mentioned, there's always that opportunity that it presents on what can be done differently and change, and even the business opportunity, like what the current Professor Pate's administration is trying to do in the health sector right now, to unlock the healthcare value chains and make it productive. So you spoke very well in line with all of these, and I'm glad to have had this conversation with you today.
Thank you. Thank you very much for having me on Curated Conversations.